After an injury from a car crash, it is left up to you to figure out the best treatment method. You want to get out of pain as quickly as possible, stay out of pain, and prevent future problems from occurring. It is common knowledge that pain medications and muscle relaxers from a medical doctor will help alleviate the pain temporarily. You may know that physical therapy will help to stretch and strengthen muscles, and that chiropractic care will realign the spinal segments and restore normal joint function, and that massage therapy can help relax the muscles. But the question is, which one of these treatments will give you the best and most comprehensive results? To answer this question, you need to understand a little bit about the injury you are dealing with, or the seriousness and complexity of a whiplash injury. Your body can react to an external stimulus, such as a rear-end collision, in less than a second. This reaction consists of the body's ability to brace and strengthen itself against injury by tightening the muscles and preparing the body for impact. In fact, it can do so in 400 to 500 milliseconds. This is fast, but is not fast enough because the entire event can occur within 400 to 600 milliseconds. This means that the body is not able to react quickly enough to protect itself from injury. In the case of a rear-end impact, the structural area of the body most commonly affected is the head, neck, and upper body. In a rear-end collision, the first thing that happens is that your head accelerates backward instantaneously at the speed of the impact. It then gets thrust forward at the rate of 2.5 to 5 times faster than the rate of the impact. This means if you were at a complete stop and a car strikes you from behind at just 10 miles an hour, your head would get whipped forward, thus the term whiplash, at a speed to 20 to 50 miles per hour. That equates to about 25 tons of force, or falling out of a 2-story building. Fortunately, some of that force is absorbed into the car's bumper, the car's body, the seat back, and the headrest, and not all into the occupant of the vehicle. If part of the force was not absorbed by these things, it would kill you. During the time of impact, the high tension and shear forces can tear, rip, sprain, strain, or herniate more than 16 different ligaments, 20 or more muscles and their associated 40+ tendons, 6 cervical discs, 16 nerve roots, and that is just the neck. The tearing, ripping, and spraining all happen at different levels, depending on the number of different factors such as age, gender, whether you were braced for the impact, or if it was a complete surprise. If your head was turned to the left or to the right, or if your head went backward into a well-adjusted headrest. Your body is a beautifully complex machine the Lord has engineered, and after it has been traumatized by a car crash, it needs a specific type of treatment to help it heal. If you only see a medical doctor for pain medication and muscle relaxers, then you're only addressing the symptoms of the injury, which most likely will return once the medicine has worn off. If you're only seeing a physical therapist, you may be exercising, stretching, and strengthening muscles, but not correcting the spinal alignment. If you are only seeing a chiropractor, you may be getting the spine realigned, but not addressing the rehabilitation and strengthening of the muscular components. If you're only seeing a massage therapist, then you may be relaxed temporarily, but in the long run, you're not addressing all the underlying components causing the pain, including the bones and the nerve damage. There simply is not one type of treatment alone which can address all the complexities of a whiplash injury. That is why combining all 3 disciplines, chiropractic, physical therapy, and massage therapy, will provide you with the treatment that results in your absolute best chance of recovery. Independently, these treatments will help, but collectively, they are all proven to be incredibly powerful and effective. Your benefit from this care comes from years of experience in treating literally thousands of whiplash patients successfully. Since whiplash injuries happen at different levels of severity, the pain may range from some stiffness and soreness to extreme pain and restricted movement in the head and neck. If you experience any of these symptoms, you can be certain that you have an injury that, without exception, needs to be checked in order to determine the degree of severity and what care is needed to correct these issues as soon as possible and prevent future, more serious problems. Many people place more emphasis on getting their cars repaired correctly than getting their bodies repaired correctly. The fact of the matter is that most people will go through more than 10 cars in their lifetime, but you only get one body and you have to live there the rest of your life. Doesn't it make sense to you that getting checked for injuries are more important than getting your car fixed? The insurance company realizes this, and that is why they make you pay a deductible on your car, but not on your injuries, which are covered 100%. You owe it to your future health to make this a priority, and we will help you accomplish that. One of the biggest concerns people have about receiving proper care is their financial responsibility. For this reason, you should know that after years of experience in dealing with thousands of cases, we are sure that we can help you. Between either your insurance company or the insurance company of the party at fault, your care should be covered 100%. If after reviewing your case we accept you as a patient, you will receive a guarantee in writing that you will not have to pay a single dime out of your pocket for your care. In fact, we are so confident that your care will be covered 100% that if it is not, you will never receive a bill from us. Please call today for your free case evaluation, consultation with the doctor, and one specialized x-ray.